Smile on my face. I'm happy. I just finished meeting with some parents. I had met with them several months previously about their child. All sorts of behavior issues at school. I think it's a 10-year-old child. The result of meeting with the parents alone, by getting the story, I was of the impression that this child may have an undiagnosed learning disability and/or an undiagnosed auditory processing disorder, and there were concerns for anxiety as well as depression. They took their child to some diagnosticians, an audiologist and a psychologist. The reports came back a few weeks ago. Lo and behold, the child does have a learning disability. Lo and behold, the child does have an auditory processing disorder. Lo and behold, yeah, the child meets criteria for having anxiety and depression. But here's the thing. I'm of the view that that anxiety and depression are secondary to an untreated learning disability and auditory processing disorder. Here's the thing. Undiagnosed, this child goes to school and can't keep up with their peers, feels stupid about themselves, sees assignments come in that they feel that they're not going to be able to accomplish. That creates anxiety if I can see it coming and I'm already expecting a negative outcome. That creates depression if I feel badly for not keeping up with my peers. Diagnosis is important. Assessment leading to diagnosis is important because now we can more appropriately meet that child's academic needs. That child's already had an IEP, an individualized education plan, the result of the reports that came in. That child is already receiving some special education services. That child is already reported as being happier. How about that? So we don't need to treat the anxiety and the depression specifically because that's secondary to these other issues. You treat the other issues, the anxiety and the depression takes care of themselves. So parents, here's the lesson I'm trying to convey. It's really important to understand when your child presents with behavior, when your child presents with anxiety and or depression. It's important to understand what's driving it. Is it biological in nature? Is it psychological in nature? Is it physiological in nature? And how do we deal with that? Because then as we deal with that, the anxiety and the depression looks after itself. I'm happy. Parents are happy. They know what they have to do to meet their child's needs. I'm Gary Derenfeld. I'm a social worker. YourSocialWorker.com. Bye now.